Hello friends, this is Dr. Arun Panda, facial plastic Cranio-maxillo-Facial Surgeon, Mumbai, India. So we practice to create beautiful faces. We work on the face and head and neck area. We do facial plastic surgery procedures like facelifts, rhinoplasties, blepharoplasties and many other surgical procedures, and of course non-invasive procedures like Botox, fillers, threads and a lot of hair transplant procedures to make your face beautiful. Now let's get on to the next episode of our demystifying the facial aesthetic concerns of our patients, wherein we try and clear off scientifically all the doubts which our patients and my colleagues they have, and they keep on writing to me. So this time I'm going to answer one of the queries of my patients. So he mentions that, "Doctor, I have been traveling on the motorbike with my helmet on for a few years now, and I see I'm losing a lot of hair. Now what do I do and why is it so?" So let me just try and explain you this, why we lose hair, and I'm going to demystify a few things about hair loss. So the problem is the patients come and ask us that, "Oh, I changed my place and I have started losing hair. I have been wearing my helmet for a few years and I'm losing hair. So what do I do now? Should I go back to my earlier place? Should I change my water?" And a lot of things like that. So let me just try and explain you this on a scientific approach. Basically, when we start losing hair, the whole process scientifically or medically, it is termed as alopecia. Alopecia is when we start losing clumps of hair from our head or any part of the body. Now what exactly happens is, there could be two kinds, and there could be two basic reasons why we start losing hair. But before that, we need to understand something. If you lose about 100 strands of hair per day, that's absolutely normal, because the hair goes in on a cycle wherein it starts growing and goes to rest, and then the hair follicle falls down. Not the hair follicle, the shaft falls down, and then it starts growing again. In this process, we lose about 100 hair strands, which is absolutely normal, so you don't have to actually worry about it. More than that is actually a worrisome situation. Now, as I was mentioning you, alopecia, it could be, or the hair loss, it should be basically, it could be scarring or it could be non-scarring. So I would say it could be scarring or it could be non-scarring. So scarring is when we have trauma, we have burn, or we have damage to the hair follicle and the hair follicle doesn't grow back again. Like if there is some bacterial infection to the hair follicles, the hair follicle dies off. If there has been a trauma to the hair follicle dies off. If we have burnt our hair follicle, we lose the hair follicle, and these conditions, the hair follicle is never going to come back and it's not going to grow the hair. The other situation is basically the non-scarring alopecia, wherein because of a few conditions we lose hair, but the moment we start reversing those conditions, the hair starts growing back. Let me give you a few examples. First thing is, women at the age when they become pregnant, during pregnancy they lose a lot of hair. But that's normal. Once you start, when you have delivered and things like that, later on you start developing and growing new hair. The patients who are under certain medications, during these medications, when they are on those medications, they start losing hair, but later on they start getting hair when they stop it. When you take chemotherapy for cancer, you start losing hair. The most common kind of this kind of alopecia is something called as a pattern hair loss. Pattern hair loss means it is basically a combination of your genetics and a hormone called testosterone in the body. I'm going to explain you in a few minutes now. So basically, as I mentioned, pattern hair loss, or it is also mentioned as androgenetic alopecia, wherein the patient starts losing hair because in the genes there is a certain gene which comes from your great grandfather, from your father to you, and you are susceptible and you start losing that hair there. Okay, so basically, as I mentioned, it's a combo. It's basically the genes and the hormones which work on their hair follicle, and we start losing the hair. So not everybody is actually susceptible to this kind of a hair fall. Those people in which the genes actually come from ancestors, you start losing hair. Now you might ask me, why can't we do gene therapy in this kind of conditions? No, it is practically not possible, because although we have understood the genes which makes this hair fall, but we are not very sure about it, and if we start switching these genes off, maybe are going to have detrimental effect on the other systems, other parts of our body, which may be very harmful. So gene therapy is still not the which can actually help in this kind of hair loss. So that's about your genes. Now there is a hormone called testosterone, which is very naughty, which is there in the males, and of course in a few quantity it is also there in the females. Now what actually happens is, if you see closely, this is how the shape of the hair follicle is. Now what happens is, the testosterone, it's a hormone which is there circulating in your body. Now this testosterone actually comes onto the hair follicle. So basically this is a hair follicle wherein the hair grows because of some growth factors which are given by the body, and these growth factors actually, they initiate the hair to grow. They keep on growing in a cycle which is called the hair growth cycle, and a few stages of this hair growth cycle we all know as anagen, catagen, telogen and exogen, wherein the hair falls. Now let's not talk about that. So the growth factors are the ones which keep on pumping and pushing this hair to keep on growing. Now this testosterone, the hormone testosterone, actually goes in here into the hair follicle, and it is converted into a more potent form called dihydrotestosterone by an enzyme called 5-alpha reductase. Now the problem is this. So this guy, the 5-dihydrotestosterone, what it actually does is starts actually working on the cells of this hair follicle, and it gives a negative feedback to this hair, and the hair basically goes into a condition known as miniaturization. So what exactly is miniaturization? The hair follicle grows at a particular thickness, and then this kind of things happen, or the negative feedback is given. So this growth factors which are there, which gives you the positive feedback to the hair to grow, so this starts giving a negative feedback, and this hair which is growing in a particular thickness, this starts becoming thinner and thinner. Now what is actually happening is, the problem, as I mentioned, is this DHT, which is kind of giving us this trouble. So this kind of everybody has hormones or has testosterone, but patients who are susceptible to this kind of conditions, or the androgenetic alopecia, when this gene is basically working on you, that is when we start having this kind of hair loss because of this DHT. Now this guy has got a very paradoxic effect. So here in this part of our head, so we lose hair, but this guy also has very good effect in the hair growth. So this is how this guy helps the hair growth in the other parts of the body. So it has got a paradoxical effect. So it is, it's very scientifically complex. Let's not talk about it. Okay, so as I was mentioning you, so this hormone is what influences the hair to grow less and cause miniaturization. So there is a lot of concerns people have, that okay, I am going to this I am wearing the helmet, that is why I am losing hair. But most commonly what happens, of course this can happen if you go to the sunlight, expose yourself to sun. The scientists have actually now researched many other things which are actually involved in the male pattern baldness. So the other reasons could be lack of nutritional therapy, lack of multivitamins, there could be inflammation in your scalp, and there are many other reasons which have been kind of a predisposing factor for male pattern baldness. It is pattern baldness which can happen in the males and in the females. So why it is called pattern baldness is basically it has got a typical way how the patient loses hair. Okay, now for a male what happens is, we see that the hairline starts retracting down, so we have thinning of the hair and we start losing the follicles from here, and it goes an advanced kind of a condition where it goes and meets the alopecia or the bald patch here. So that's basically the pattern wherein like patient moves from the hair baldness goes from here and it comes from here, and then finally it meets wherein like we see the patient doesn't have is a shiny baldness. But one thing you would have definitely noticed is this part of the hair which patients do not lose in this kind of condition. So because this particular hormone, the DHT, has, as I said, it is really, I mean, it's a paradoxic thing. Why that this works here and this doesn't work here? We have still not tried to, kind of demystify things. Scientists are still working on it, but the condition is that this part of the hair, or the back part, which you call as the occipital part, they do not fall under the influence of DHT. That is where we normally take the donor for our hair transplant procedures. So these are basically insensitive to the androgens or the testosterone, and this is what we take as a donor and we transplant it on the areas wherein we have lost the hair. So basically, there are many conditions, as I mentioned, in male pattern baldness. The same thing can happen in females also. The same hormone works and influences, but typically if you see in a female, there is no hairline loss. There is basically thinning of the hair, thinning of the area. There is less density. The density becomes lesser, and the female patients who come to us and explain about female pattern baldness, there is no hairline loss, but we will see lesser amount, or the density has actually reduced in this kind of patients. There are many treatment options which we will explain later, but then that is how normally we start losing hair. So there are treatment modalities, but the most important thing is basically we need to understand it earlier. So if you are losing hair, the first thing, when you start seeing clumps of hair falling and you're losing more than 100 hair strands in a day, it is time that you got to see your physician, got to see your doctor, and try and understand the condition. Is it your androgenetic alopecia, or it's your normal hair which is falling 100 or something like that? Because if you start treating yourself from an early age, you try and save. Now, since we do not know what is the starting of this condition and where it ends, it's always advisable for the patients that they go to the doctor as early as possible and start getting the treatment done. Okay, so I hope I could actually explain you what are the conditions in which we start losing hair. As I mentioned, people saying that I have changed my place, that's why I'm losing hair, or I wear my helmet. Actually, we do not know that it is mostly androgenetic alopecia or the male pattern baldness because of what we are losing this hair, but we try and put it to the other conditions, like of course, as I mentioned, eating well, or losing not having the proper diet, or inflammation on your scalp, and other conditions also influence this kind of conditions or aggravate this kind of pattern baldness. But most of the times it is basically the hormones and the genes which is which are working to lose hair. Okay, so I hope I have explained you well how we lose hair. So if you have any queries on any of your facial aesthetic needs, any facial plastic surgical procedures, nose, eyelid, or hair restoration procedures, or facial aesthetics, Botox, fillers, threads, anti-aging procedures, anything, please send me a query. I'll be more than happy to resolve it and answer it in my future videos. Thank you so much. Dr. Arun Panda signing off.